There is so much more that meets the eye when it comes to becoming a cosmetic dentist. If you're a dental student, if you're a young dentist, if you're a new graduate, and you want to start understanding cosmetic dentistry, there is a path to take, and it's going to take some time. Here we are going to talk about the step-by-step process of how you can get there and approximately what it's going to take out of you, how much it may cost, and to not be too upset with yourself along the path because there's so much that you have to learn and be humble about in this cosmetic profession. So Oscar is someone that I really look up to because he has taken so many right away out of college. I mean, out of dental school. He's taking so many courses right away. And it's unique because a lot of people go to residency, like myself. I went through a residency program, a GPR. And Oscar went through COIS. He went through all these other amazing continuing eds, and I want you to talk about your process because you really have changed the trajectory of a lot of what people look up to now graduating dental school.
So, well, first of all, thank you.
You're welcome.
You look up to me. You guys got that on camera. She looks up to me.
He was one of the first people that sparked that in me, so I appreciate it, Oscar.
So I decided I didn't want to specialize. And the reason being is because didn't have the best yes and no experience in dental school. I had two great professors that I freaking loved them to heart because they pushed me and they always empowered me to do more and they never put the brakes on me. Dr. Mafa, I love you. He was always incredible. But then I had a lot of people always, in dental school, as you guys know, you're always so limited into what you can do. Everything is an excuse. And they kind of cut your creativity. They don't let you grow mentally. They don't let you expand. They don't let you really get into dentistry and really get into the challenges. Mm-hmm. They just kind of have to walk you. So they want you to graduate with just enough so the school just has the prerequisites that you have to meet in this little thing.
It's preliminary education.
Exactly. So I decided that why go to an institution where I was going to be kind of in the same thing. So I found what I wanted to do. Very early on, where I wanted to be, I said to myself always, I want to be the greatest dentist ever. And I don't care about money. I don't care about anything. All I care about is my craft and being the best at what I do. So I decided I wanted to go into cosmetics, and I decided that I needed to follow a path. So during dental school, the 4-year, I joined Maxi course. Then COVID happened, all that, so that got canceled. And then right after dental school, not even a month after, I wanted to do implant surgery. I wanted to understand it because to be a cosmetic dentist, you have to be a master of all crafts. You got to understand the process of everything because cosmetic dentist is not just putting veneers. It's calibrating a bite. It's giving function, biology, everything. So you got to understand that all to be a cosmetic dentist.
That's probably why they don't teach that in schools.
They don't teach it at all.
Because you need to really, really know the foundations, the basics, and also when it comes to occlusion, you do learn the basics, but how amazing is it that we can go into such depth with continuing education courses?
Exactly. So, I mean, I haven't specialized, but I have over 587 CE. Really? Since
Bart,
I graduated.
how many do you have?
It's over 1,000.
Yeah. He beat me.
Yeah, but I've been practicing though. It's been.
In 3 years, 3.5, 2024, like 3 and some years, that's pretty impressive.
No, that is.
So,
and that's why you are
exactly.
where you are.
But I mean, I finished dental school and I wanted to go surgery, so I went to implant pathway. I did the whole curriculum, the 4 courses back then.
Yeah.
Then at the same time, I started COIS.
But
I asked what was the best academy that would train me. So, Dr. Ferry, he's my mentor. So that's beautiful that we're all here. He told me, do COIS. And I started with COIS. I graduated already. But, every year I said to myself, I am going to live. I've been in dental school. I've been broke as hell. So I'm going to live the same way. I'm going to make money now, but I'm going to live the same way. So I said, this is 4 more years. I spent about $50,000 a year, 50 to 60, in not just the CE, but like what entitles for the CE, because every time you take a week off, you're not making money that week. You're paying for hotel, food, blah, blah, blah. So when you add it up, it was about 50 grand a year. that I put into my education. So every year, I did COIS, I've done implant pathway, then I wanted to learn connective tissue, so I did Pat Allen's course in connective tissue, then I did full mouth rehabilitation, then I did Miguel Ortiz's course. So I've taken like all the courses, but I was lucky enough to have a mentor that kind of guided me into the correct CE, because there's so much CE out there. But you kind of have to put in your mind what you want to do and the dentist that you want to be and the person that you want to be. And then you have to follow that path and you have to follow it to the T.
There's always someone who knows the skill and the craft better than you. So a part of it is being humble, but also go out of your way to reach out to someone that you look up to. Because the chances are they're going to respond. They were once where you were. And if we can continue to share our knowledge in this manner, we can improve dentistry as a whole.
And that's the goal. Like giving back is very important. I know for one, I didn't have that mentorship. I
Same.
learned in the Fetty School of Hard Knocks.
Same here.
So
Medicare, Medicaid, HMO.
Yeah, I learned the hard way. So when I met Oscar for the first time and I saw his drive and his passion, I was like, he's the one.
But you have to be determined into what you want. Yeah. Because the first time I was there, I wasn't the one. I was just a freaking cocky ass college guy that just graduated. But I insisted.
Correct.
And that was the thing. I didn't accept no for an answer. I didn't accept that. And I was like, I look up to him and I want him to teach me and guide me. And the first time, I get people that ask me questions on Instagram. And like new grads, they ask me a question and then I have answered them. I freaking send them a paragraph long. And then they don't even fucking say thank you.
I know.
Like, you know what I mean? Like, fuck you.
Really care.
They don't really care.
Tell us how you feel.
No, exactly. So like, for me, I'm at a point where like when people reach out, like you gotta hit me up a couple of times. And when I know that you're really interested,
Besides reaching
I
out,
deal with that daily, bro. Daily.
It's important also when you're into this. You gotta go shadow. You gotta look at what's being done.
The biggest take home though is you can have 1,000 hours under your belt. It doesn't mean you're gonna be good at it though.
Yeah.
This is my 5th year teaching with Aesthetic Advantage. And I see so many people take it, not 1, not 2, not 3 times, 10 times. And some of them still don't get it, bro.
Because they don't have the basics. Just because
No.
No.
It's not that they don't have the basics, bro. They don't have the vision. They don't have the eye. Correct. You can have Murillo and take any ceramics. There will never be another Murillo because something in their brain can't compute it. They do not see it.
I disagree in some extent to that. I think anyone can be trained to be a certain dentist, or you can train your eye to do anything in your hands, but you just gotta do a lot of it. You gotta do a lot of it. You have to do a lot of it, and you have to be passionate, and you have to be determined to do it, and you will.
Those are the necessary qualities, but bro,
people
you
quit,
cannot.
bro. People quit. You know how many people have told me like, oh, I'm gonna take, and they don't take crap. They don't take any C, of course, and then then I'm at Aesthetic Advantage because that's the best. You know, like before I even took full mouth rehabilitation, I made sure I had the foundation, and my foundation was COIS, and you find yours, but that was my foundation that allowed me to really understand what I was being taught. Because we just because you go to these super high-end courses, you're just there paying money and taking a nice picture or whatever. You're learning from somebody that you don't even understand the why they're teaching you something. When I took FMR, I knew how to do FMR. So I learned
but the thing is, though, if it was like that, Oscar, then all the dentists would be like you and all of us.
Because that's where you've...
But they take the courses, though. How come if all the graduates of
But they're taking the courses differently, though. They're taking it
but they don't. No, the thing is, the comprehension and the understanding isn't there.
You need to come with some type of basic knowledge. Is that where we're coming to a conclusion?
No, it's just that if something doesn't click in the brain, they don't get. They won't see it.
I'm gonna pause. They need to learn fundamentals of occlusion.
Yes.
Period.
That
is the base.
Yes.
If you don't understand why the single teeth dentistry is breaking, you can't get into quadrant dentistry. You can't get into FMR. Why are people failing when they do that? Because they want to do Facebook Friday. They want to say, I do an FMR, I do a 28 unit in your case.
Full
they
arch
want to
Fridays,
do here, and they want to sprint before they could crawl. So you have to understand why that single tooth broke in the first place.
Before you do the 28.
Right?
Yeah.
So that is the most important. So when Oscar came to me and said, where should I start? I said, fundamentals. Occlusion. It's like learning how to play any sport. You learn how to play sports in football, I learn how to tackle.
But if that's the case, then why is everyone not a LeBron James?
Because not everybody has the guts to do it. Exactly.
Bro, there's so many innocent kitties that
I'm going to say something, all right? Love you all, okay?
I know.
The one thing that I think it's very important, every dentist, and what you're saying, Bart, is very, it could be very valid. So I'm not.
No, that's fine. That's good. It is.
But I think every single dentist has something very unique about them.
Yep.
Yes.
No matter what it is, no matter what sect of dentistry you are in, there's something unique about you. And that also builds in with your brand and what you're trying to build for yourself. But that also can show in your craft. So yes, we all have a vision of what cosmetic dentistry should be. We all strive for high level cosmetic dentistry. But also people have their own perceptions of what looks amazing to them. So how do we standardize that?
So here's the thing. When I first started, I cannot do. I've always said to myself, I cannot play a single instrument. I suck at fucking drawing. I suck at anything that has to do with art. And during dental school, when I had to do a filling and make it look nice, I fucking sucked at it. Okay. And then when I was in the chair, my first year or whatever in dentistry, I remember sitting down, and my first day at work, I had 5 fillings in 1 hour. And I told the guy, there's no fucking way I'm doing 5 fillings in an hour. I can barely do one, but I'm gonna do 1 filling in 1 hour. But I made that, and I made sure that filling looked freaking nice. And then my next one was better. And then what I did is I took a fucking photo every single time. Boom, here's a photo of it, and I posted it. Because that now, by me posting it, that's me putting something out there.
It's accountability.
Exactly.
And this is where I'm at.
And that's why,
And then I got better at it. And then I got to do 2. But I was perfecting the littlest thing. Even now, we were talking about it. Like, I spent the past 2 weeks waxing. How many dentists go back and like, oh, I'm gonna get, no, they're like, no, I already did waxing in dental school. I don't need to. They don't do that. But you know how much I had learned just waxing, that I did it in dental school and I didn't learn anything. And now I went back to it because people do not have the drive to continue.
And practice.
Exactly. Yeah. I had an oral surgeon, Dr. Youngblood. He was another mentor during dental school. And he said, even a monkey can choke out teeth. You teach a monkey how to do something in so many times, you're gonna get there.
But you can't teach them how to block carved temps, bro.
Come on,
man. Pull the tooth out.
You do enough
Come
of
on,
it.
man.
You spend every single days doing it. You will get there.
You'll be better than you were the day before, but you will not be to the level of an APA. No, you won't.
You will.
There's no way. No.
But you need to get to that training.
No,
that's the thing.
Bro, that's just like saying if I practice my free throw every day with the top free throw specialist and take all these energy drinks and supplements, I will be as good as an MJ under pressure.
Oh, no,
it will not, bro. I'm
Some
telling you.
Some people have a gift, for sure.
And not yet. Yes. They're extremely talented, extremely skilled, I should say. Not talented, skilled. Exceptionally skilled is the word. And I'm telling you, it doesn't matter how many levels of C and all that. It's a combination of book smart and street smart. Because you could name all the bacteria. Name to me all the red bacteria. Cool, you're so smart, you could do that. Now go carve that. Can you carve that? No, you can't. Go take the courses. 10 years later, can you still carve it that good? No, still can't. Dude, I mentor so many people. I will show you photos of people who've taken the courses, taken clinical master series, taken all the master's levels of aesthetic advantage, and they still can't carve for shit. And I don't mean any disrespect.
That's because they have bad hand skills.
Exactly.
It is what it is.
Yeah, but that's what I'm trying to get to, though.
No, I mean, talent plays a role. I'm not saying
that it does.
No, it plays, but talent alone will not get you to where you're at. Appa did not get to where he was at because he was talented. He got to where he was at because he was persistent at what he did. Bro, and he never gave up, and he made dentistry his life.
I know.
So I'm doing the same thing.
But bro, how many people do you think that Larry taught, Dr. Rosenthal taught, and we're in the same umbrella? You only see the successes. You see the John Marashis. You see the Dr. J. Lerners, the Gerards. You see all that entire aesthetic advantage. You don't see the failures, though. Why? Because you don't know. They never existed. Those are the people you don't hear about. If I were to show you these people right now that have taken all these courses, you don't know who they are either. But you didn't know they took all those courses. You just see the other people. You just see the light is shining on the people who are excelling. But there's so many people that don't make it there, dog. Like, no, I mean, you are the exception.
It's competitive.
At the end of the day, they need to have the drive, the skill set, determination, and be able to communicate with their patients what they're trying to envision.
Yes.
So it's a trifecta.
Yes.
Which not everybody has a trifecta because we all know great hand-skilled dentists that are incredibly talented.
Yes.
That are broke.
Yes.
And they have terrible practices.
And the last thing to like close it off, personality is huge,
Dude,
because you can have the worst hands,
Yeah,
but if your
bar
patients
is
love you,
important.
That's true.
game
That's true.
over.
But the other thing is,
Game
remember, this is
over.
a teamwork. So let's say that I don't make the temps as great as Appa because they don't, or as great as Brandon Mack. That makes temps that look like freaking veneers. I'm not there, but I will give the lab a 3-dimensional guideline. Maybe my inside, my whatever, my vote, it didn't look as perfect, but I gave him something. But now I'm working with a team that is going to back me up. So as dentists, we have that. You don't need to be the freaking greatest at doing everything from beginning to end. But it's getting easier. But you need to be determined into becoming great, and you need to know where you fall short. So maybe my temps suck. I'm gonna try to get him there, but I'm gonna give him at least a guideline. I'm gonna give him parameters where he's gonna stay in this box. And now I'm gonna use this guy that is great at doing this, and he's gonna complement my dentistry.
So now let's give the guidelines to those CEs so we can circle back.
Besides the trifecta, humility, drive,
pretty much what's
skill set.
important is developing a foundation on bite, occlusion, understanding that, taking courses like Spear, whether it's COIS, whether it's whatever it is.
Clinical Mastery Series.
Clinical Mastery Series, whatever it is that helps you develop a base level understanding. And then from there, slowly going up the ladder, because it's a triangle to get to the specialty point of cosmetic dentistry. You can't just get to the top of the mountain. And having mentorship that helps you see what we see, and then be able to then convert that in hand skills, whether that's a mentor that's hands-on, or a mentor that could FaceTime you and go over things, sharing.
That is very true.
Sharing clinical photos, sharing clinical photos, understanding that preparation design, understanding how to prepare teeth properly, being comfortable to show your failures and say, hey, I don't know if this went well. What are your thoughts? So then you're better, right? Because at the end of the day, that's what makes it critical. So the courses, they are what they are. There's so many courses you could take. Just make sure you have a basic understanding.
And
don't
finish the curriculum. Don't just take a one and then and you're done.
Finish the curriculum, and then the other thing is what you just said. You have to find another set of eyes and see through their eyes. So, for example, when I got to where I'm working now, I sometimes, not sometimes, every time Dr. App is working, I'm watching what he's doing. And sometimes he's pulling the lips back and looking. And in my head, I'm just like, what is he looking? What is he looking for? What is he looking for? But that's something that before I didn't know. I would have never even thought about looking at something a certain way until I saw him doing it. So having that mentorship, high quality mentorship,
because that's when it clicks.
Exactly, that's when it clicks. You're like, oh, that's why you're looking at. And when you see that, that's when you can really improve, because now you know something that you didn't know. And if you didn't know it, you didn't know it even existed. So that's where you don't want to be. You want to know more so that you can see more, and then your hands will get there. Exactly. They might not be Appa's hands, they might not be, but you're gonna get there, bro. You're gonna get close to it.
You'll be better than the person you were before.
If you're if you're a dental student and you're graduating tomorrow and you're watching this video, the first thing you should do is take a vacation. By the way,
no, don't take any vacation.
No, I don't take any
vacation.
All right, take at least a month off from life.
I work 6 days a week my first 5 years. No vacation.
No vacation.
In
10 years, you can take a vacation. Now is the time to grind.
All right. Take 2 weeks, please. Do it for your mental health. And then start reaching out to someone that you look up to who is a skilled person, professional in their craft, okay? Make a connection with them. Ask them questions. And don't forget, when you start, don't do anything that you know you're not capable of without talking to someone, because you could do more harm than good. And that's why we're here and we're sharing this information with you guys. So thank you so much for constantly watching. We are always here to answer your questions.
Feel free to DM any single one of us if you have any questions. We'll be more than happy to help guide you in your path.
We'll
DM me a couple times. I'm not going to answer you the first time.
Just say thank you.
and freaking say thank you.
Say thank you. Always say thank you.
If I spend 20 minutes writing it, say thank you.
And when you shadow, bring cookies. When you shadow a dental office, bring cookies. Okay.
Thank you, guys.
Take care. Thank you, guys.
Thank you.